Ladies and gentlemen, please welcome to the stage co-chair of the Child Health Pillar at the GBCHealth Alliance and co-founder and co-chair of the Giving Circle Women of Strength, which supports female social entrepreneurs, Ms. Leith Greenslade.
Good morning, everybody. I want to congratulate GBCHealth and particularly Pam Bolton for the unprecedented focus on children at this year's conference. So preventing those 4.4 million child deaths that we keep hearing about, that number, it's a very big number, is by far the greatest global health challenge before us. What's clear to me after the panel this morning is that if you really want to make your mark on MDG4, you need to be very focused on the leading killers of children and active in the countries where those deaths are concentrated. So think 5 and 5. Think pneumonia, diarrhea, malaria, newborn and nutrition, and think India, Nigeria, DR Congo, Pakistan, and Ethiopia. Because that's exactly where you need to be and where we need you to be to achieve MDG4. But now to our spotlight. Like so many breakthroughs in the history of human health, this one begins with an individual who did something differently. One person who decided to do something that no one else was doing. And the thing that he decided to do differently was to talk. To talk. To talk to soap manufacturers. 15 years ago in Guatemala, Camille Sade saw children dying from infections that could be prevented by hand washing with soap. So he sat down with soap manufacturers and invited them to be part of the solution. Fast forward to 2013, and we have a global hand washing movement that is one of the strongest in public health. We have all of the leading soap makers, Colgate-Palmolive, Unilever, and P&G, fully engaged. And Global Hand Washing Day, which is October the 15th every year, is now celebrated by more than 200 million people in over 100 countries. But before you meet Camille, we're going to show you what I think is a high point in the global hand washing movement. A campaign from Unilever for India, where child deaths from infectious diseases are concentrated, educating people about the connection between child survival and hand washing with soap. This was crafted by a commercial advertising agency in India, and this is the very best of private sector creative talent in the service of a public health goal. And 7 million YouTube views, that's right, 7 million YouTube views testify to the power of this approach. Take a look.
ஆளொரு மேனியும் பொழுதொரு வண்ணம் என் மகன் வளருகிறான் உள்ளங்களிலே இன்பம் பெருகிட மனதில் நிறைகின்றான் ஆரோக்கியமும் அறிவும் பெற்று வளர்ந்துட்டானேயா ஐயா ஆளொரு மேனியும் பொழுதொரு வண்ணம் என் மகன் வளருகிறான் உள்ளங்களிலே இன்பம் பெருகிட மனதில் நிறைகின்றான்
मेरा बच्चा 5 साल का हो गया।
इतना सब 5 साल में कौन सी बड़ी बात है?
बड़ी बात है मैडम, ये गुंडापा का पहला बच्चा है जो 5 साल की उम्र तक पहुंचा है।
क्या?
25th birthday, would you walk on your hands, on your feet, on your head, anywhere? This is a very powerful message. And this is what the private sector brings to a seemingly simple intervention like hand washing. But hand washing is so effective. It all started actually as all of us are travelers with this, a soap from the bathroom of the hotel where we stay. This is how it started. So I was in Africa, Latin America, or India. I would go and give the soap to the street children or to the children in the rural areas. And this is how it started. It gave me the idea that children, some of them, saw the soap for the first time and would smell it. Some would lick it, actually. They did not know the soap. So there was a need to let them reach the soap and use it properly. And this is how it started. We looked at what the government, the Ministry of Health were doing in several countries. Yeah, there were lame messages, you know, very unimpressive messages about hand washing. So as Leith, who introduced me, and thank you, Leith, I went to the soap companies in Central America and I told them, look, the government of Guatemala or El Salvador or Nicaragua are, you know, in agreement, but they don't have the means, nor they have the pizzazz to really make hand washing sexy, attractive. So what can we do together? We started a market research about behavior of hand washing. Why people wash their hands, why not? And try to identify the barriers. With this result, the results from market research, we sat down, and as Leith mentioned, yes, there were multinational companies, but also local soap companies, and together we developed a marketing plan as a business plan based on the research. And this is how a communication campaign, a market campaign was developed. And if I know how to press this, this is what's happening now. But it started 15 years ago with Lavo mis manos por salud in Central America, 5 countries of Central America. And the campaign was so attractive that suddenly the government of Guatemala, the Ministry of Health, appropriated it. Lovely, great. In El Salvador, the Ministry of Education took the lead and did a program called Escuelas Saludables, healthy schools, where they integrated the protocol, the hand washing. And hand washing is basically 2 things. It's the technique and the timing. Technique, you need 2 hands. You need water and soap. In terms of timing, it's the 5 critical times: before touching food, before cooking, before feeding the child, and after the toilet, after cleaning the baby. So based on these occasions, we focused our approach. And we learned from the companies. Colgate-Palmolive has a great oral hygiene program, and one of the things is to teach children is you go from red to white. And this is the way. So it's those small things that make that behavior memorable, but also easy and fun. So let's move a little bit forward here. We heard about the death toll among children below age 5. Hand washing is an amazing, cost-effective vaccine. It's a vaccine. It's a do-it-yourself vaccine. Diarrhea risk, according to a recent study by the London School of Hygiene and Tropical Medicine, is reduced by 47%. Pneumonia is reduced by 23%. And these are the 2 major killers of children below age 5. Why don't we do it? It's so simple. But we need what the private sector, together with the public sector, can do. Let's give you some example. I'm not going to go over the statistics, the 2 million deaths, 1.3 million due to pneumonia, and 700,000 still dying from diarrhea. But we develop, based on the Central American experience, we develop with the World Bank, USAID, this global partnership, global PPP for hand washing. And FHI 360 is the coordinator, it's the secretariat. And I'm very sorry that my colleague Katie Carroll, who is the coordinator, could not come. But you would understand why, because she is the happy mother of a 3-week-old baby named Tyler. So she could not walk on her hand neither. So this is the global partnership. You see the 3 big multinational soap companies, but also UNICEF, USAID, the London School, University of Buffalo. We launched 5 years ago the Global Hand Washing Day on October 15. This has been a fiesta. It's a celebration. Hand washing is fun. Just look at children handing wash, and they're splashing around, and they're singing, and they're happy. So starting at school makes good sense. Look at those characters. You see the drop of water, the soap in the middle, and the hand. And this is thanks to Procter & Gamble, who appointed its creative agency to develop those cute characters. And these 3 characters are everywhere now. I was in Indonesia, and they had it. They had it in school, in health centers, on the walls of the health centers, in Kenya, in Dakar, Senegal. This is another example from Nairobi. In Nairobi, you see these 3 people. These are Unilever people, you know, going to school. That's the vice president of personal hygiene doing it. The key thing for hand washing is the hands, the soap, and the water. But a station for hand washing is essential. It does not need to be expensive or elaborate. Look at this example here. It's the tippy tap. It's a rope that is manipulated by the foot, and it tilts the container, in that case, a water bottle, and with scarce water resource area regions, this is ideal. They can just tilt enough water to wash their hands. So these are low-tech technologies that have been developed by the community itself to implement a behavior as simple as hand washing. So you can get involved. The civic society, the private sector, as well as the government, together we can do things to promote hand washing and make it a cost-effective vaccine for pneumonia and diarrhea and other waterborne diseases. So my plea to you is get involved, sponsor schools, community activities, go viral, and participate in the Global Hand Washing Day on October 15. And this is I'll end up with this slide on the website for the Global Hand Washing .org site. Thank you very much.